Well, it is Medical Monday. As you know, Houston has the world's largest medical center, so among other things, we are a leader in the area of cancer research. Our first hot topic today certainly got people's attention. A doctor came up with a more precise surgery to eliminate pesky cancer cells without removing the healthy cells. But how did he do it? Let's find out in Hot Topics. Hot Topics today, please welcome ear, nose, and throat specialist Dr. Raza Pasha, family medicine doctor and anti-aging specialist Dr. Bruce McClendon, bariatric surgeon Dr. Clifton Thomas, hormone specialist Dr. Stephen Hotze, and oral implantologist Dr. Farid Noie. Good morning. Okay, so as we know, when you're doing surgery for cancer, oftentimes you dig out what you think is cancerous, and then you kind of go and dig out the extra just in case those cells have spread. So the problem is sometimes there's damage to healthy tissue. So a doctor came up with a way to kind of eliminate that process. So let's explain what that is that he came up with, the tumor paint.
Sure. Well, as you explained, the challenge for surgeons when we're dealing with cancer is that cancer, when you look at it visually, all looks the same, right? So we have to not only take out the tumor where we visually see it, we have to normally take normal tissue around it so that you have a good bite, so that if you have microscopic cells that go in there and you can't see it, you've got a good margin. So what this doctor has suggested is that he actually looked at, he noticed that these Israeli scorpions, actually, the venom from the scorpion, it did not penetrate into normal tissue, and it was just localized right into the cancer cells. So what he did is he lit them up. And what that means is that he took that protein and added another protein that he can see visually. And then if you put a certain light to it, then what happens is those cancer cells will light up. And that allows the surgeon to see it. That's crazy to me
that how somebody even came up with the idea of, hey, let's go to the Israeli scorpion, and then let's see if it lights. You know, it's amazing how research works and the what-ifs and the things that you go to next, Dr. Thomas.
Well, how he funded this is very important, too. He did it through crowdsourcing, taking it out of the mainstream of how you get money through pharmaceutical companies to fund and pay for this. It's interesting.
Yeah, yeah.
And that's why it's important that we save our environment, because there's so many things out there in the Amazon and different areas, chemicals that we just don't even know about yet that can be very valuable to mankind down the road.
Yeah, we're going to talk about something in the environment in just a minute. Another thing that came up is that fast food meals have more calories than you might think. You think? Right? But even things that kind of tout themselves as, you know, you can lose weight by doing this, like the Subway sandwich, for example. If you don't do your research, you can't just take their word for it. You got to kind of look at the whole thing we keep going back to, and that's portion control. And what exactly are you eating?
Well, you know, with the Subways specifically, they had this big advertising thing and showed this guy losing all this weight and everything. But when you go in there, you have to be real careful, because there's only about 4 or 5 of their Subways that fall into that category.
Right.
But at least they did now post the calories on the signs. And if you start reading, it becomes pretty obvious that one has 600 calories, the other has 1,200. You know,
yeah, you're getting the extra foot long. You know, and Dr. Thomas, what you find is that a lot of times with your patients, they don't know what they're eating.
Well, that's true. I'd like to talk about this for a minute. On the food calorie thing, we assume that information is accurate, but it's not anywhere close to accurate. We visualize there's a scientist measuring all this food, but that rarely ever happens. They use comparisons, but it's even worse than that. The way they determine calories, they burn it with a flame in a box, and the amount of heat released is a calorie, and our body doesn't work that way.
Yeah.
So we need to get off the calorie counting thing.
And also, what kind of calories are you consuming? Now, if all your calories are in a loaf of bread, then that acts differently in the body than a piece of turkey.
But the kind of food that we eat.
Yeah.
That's what the problem is.
Yeah.
And certainly, a lot of high-calorie food is not the food we
Because somehow I'm thinking if I have like 1,200 calories of bell peppers, that probably acts differently than 1,200 calories of bread, right, in the body. All right. We certainly know that one of the big issues for kids in school, I know a note came home for me in packing my son's lunch, is make sure you don't put peanuts and other kind of nuts in there, because kids have these food allergies. So President Obama has signed a bill aimed at helping kids with food allergies. It also offers a financial incentive to schools for stockpiling certain things that can help a child if they're in the middle of anaphylactic shock. So that, and we have these little bracelets right here, the allergy awareness bands that kids can wear to make sure that people know what allergies they may have. And so I know, Dr. Hotze, oftentimes I know you deal with treating allergies as well as you, Dr. Pasha.
Well, what they're recommending is that the schools put epinephrine or an EpiPen in each school, and the nurses be trained to treat a child who has anaphylaxis, which is a severe allergic reaction, which can lead to death. It causes closing of the throat and diffuse swelling over the whole body. It can be easily treated quickly with epinephrine if it's done in time, but apparently many schools aren't. It was surprising to me.
Yeah,
totally
you
unaware
often
of that.
tell your patients, carry that EpiPen. If your child has these allergies, make sure your child has that EpiPen.
Yeah,
but when you're much younger, it might be harder to handle.
Well, that's right. But I would say this, any child that does have a problem, the parent should give that child EpiPen, and he should keep it at school and not depend upon somebody else. He or she should be trained that if they're of age. You follow what I'm saying?
Right. Yeah, but it has to go to the nurse. The child cannot carry any kind of drugs, so it has to be coordinated with the nursing staff at the school nurses. So.
Okay, we actually have a whole program. We test for food allergies, and we counsel patients, and particularly not only the children, but the parents of the children, obviously. But you're right. First of all, this is a very serious issue. I mean, the balance of this is death.
Yeah,
and we have children that die because of this, and the only thing that they require is just a little bit of epinephrine.
And we were talking earlier, we don't know what's in our food because it can be in things that you think have nothing to do with nuts or any other thing you might be allergic to, and it's in there. All right, another interesting thing, anti-aging dentistry claims to provide a more youthful look. Let's say dentist in Beverly Hills, of course it's always going to be Beverly Hills when it starts, right? But he claims he can make someone look young by fixing a patient's teeth, and that does make sense.
Well, actually, there is the truth to the statement, because the first one who came up with the whole concept that, beauty is not just something that you see, but is really a mathematical calculation was Leonardo da Vinci.
Yeah.
And he came up with the concept that, if you are within the right portions, he call it golden ratio. If everything is in the right portion, you're going to look beautiful even if it's not. And then when he drew the Mona Lisa, which was not exactly a most beautiful woman, but it just looked so
smiling.
Not at all, and barely. But he drew them so perfectly that all the proportions were just right. So obviously your teeth get worn when you use them for so many decades. Eventually, as they do, your face shrinks up and it just hollows in. When you fill all that stuff in, you're going to get a more proportioned and more attractive face.
Yeah. All right, let's get back to one of the things you're saying about respective things in our environment a whole bit. Now, scientists killed the world's oldest creature. Okay, so we're asking the question, how far should we go with research? Scientists thought Ming the clam. Did you know about Ming the clam? Okay, well, Ming the clam they thought was 405 years old. Turned out he was 507 years old, but they opened the clam to calculate the rings in it, and they ended up killing it. So, you guys do not care about this clam. You know you have. But it does bring up that bigger issue. I mean, we know that's always a tough thing in research, where we've seen the other animals like monkeys and mice and the whole bit used in research.
Big clam enthusiast.
Yeah, big clam enthusiast.
But they turned him into clam chowder.
Oh, no!
They did.
It
was tasty. It was aged.
They did.
Louisiana somewhere.
They did not. Okay, but that whole issue again of, on one hand, you got to say, when you do that research, and if an animal ends up dying in it, where do you do that research to find out what's going to happen? Do you do it on humans? So...
Well, you never know where the next big find's coming from. I mean, just like scorpions, then there's spiders and different things that have different chemicals in them that we don't even know about, and how they work, and we just need time to be able to find this out, and you're not going to find it out if you destroy our resources, and especially in countries that have the rainforest and stuff where so many different varieties.
Right. But again, it's tough. I know this is an issue that comes up oftentimes. Sometimes some animals die, but the key is that's how we can figure out what's going to happen to humans, and so. It's a hard one.
It's a fine balance.
There is a fine balance, yeah. Killing for killing's sake, no, but all right, poor Ming. All right, well, this brings us to our Facebook question of the day.